In the city of Chicago, the life expectancy of African Americans is alarmingly low. Why is that? What are we doing about it? I'm Sylvia Snowden, and this is Critical Condition. If you're not familiar with the term medical desert, you probably should be, as the phrase is used to denote an area that either has insufficient access to medical care or an area where the nearest trauma center is more than 30 miles away. And if you're from the south side of Chicago, you already know where I'm going with this, because that side of the city has experienced a steady stream of hospital closures over the past 2 decades, with more potentially on the way. Now, you may be wondering how it's possible that the south side, an area of the city that boasts such a large black population, could have so many hospital closures when the city of Chicago just released a report that says that its black residents are in significantly poorer health than the rest of the city. After all, you'd think that unhealthy people need more access to hospitals, not less. Well, to try to help explain what's been happening with healthcare on Chicago's south side and what's being done to improve it are 3 very special guests. Before I say their names, though, I should say that I'm Sylvia Snowden. I'm a very proud employee here at CAN TV, and I want you to please help me welcome to today's program State Representatives Marcus Evans, Cam Buckner, and Lamont Robinson. Hello, Representatives.
Pleasure to be here.
Good to be here.
I would just say this, that I have really wanted to do this particular episode for a very long time, and I want to thank you 3 for making time to do this and making some time to have this discussion. Thank you.
Thank you. Pleasure.
Representative Robinson, we will start with you. Apparently, life expectancy for Black Chicagoans is 9 years less than it is for the rest of the city. Does that alarm you at all?
It absolutely alarms me, but more so what alarms me is that we have not fully put a plan together to have quality health care across the entire state of Illinois. That is really what's alarming. This came out of the hospital closure of Mercy Hospital. And that's when I learned that we really do not have a plan to provide quality health care across the state of Illinois, not just in the city of Chicago, but again, across the state of Illinois.
Representative Buckner, I have to ask you, Blacks have a lower life expectancy than anyone else in the city. And as Representative Robinson just said, it's a problem throughout the state. But certainly here on the south side, we've lost Michael Reese Hospital. We've lost Doctors Hospital of Hyde Park. We've lost Inglewood Hospital, and nothing's really replaced those medical care centers. How is it that the people who need most access to care are least able to get it? How are we here?
Yeah, listen, we're here because of years and years and generations of benign neglect, purposeful disinvestment in our communities. We're talking in this conversation about healthcare and healthcare delivery and medical deserts and life expectancy as they all kind of work together. But there is a convergence of all the things that many of us on this call and many of your viewers have been talking about for a very long time. We know that there's a maternal mortality gap in our community. We know that there's an education gap in our community. We know there's a healthcare delivery gap in our community. We know that turns into a salary gap and an employment gap. That turns into a quality of life gap, which ultimately turns out to be a life expectancy gap. And so how do the same neighborhoods, same community, the same people continue to get left behind over and over again is a question that has to be answered and asked on a bunch of different levels. But the long and short of it is that we have not done enough to purposefully and intentionally invest in these communities and the people who live there.
Okay. Now, Representative Evans, you're my state representative. So you and I have actually had this conversation before. So I'm going to ask you to explain to people what is actually happening to healthcare in general, to kind of bring all this together. What are we seeing in healthcare now?
Yeah, I think what we're seeing is escalating costs in healthcare. We're seeing the planning not be what we need it to be for our communities. And that's why you're hearing from folks like Chairman and Representative Lamont Robinson. I think the loudest voice in the General Assembly has been Lamont Robinson on this issue. And he's been a loud force for his voice. Lamont is saying, Marcus, what we have is wrong, And sometimes when you're African American, you say, well, this is the way it is. And Lamont has definitely been the voice to say the way it is wrong, and this generation is going to address the issues. We're not going to be silent on it. We don't care about hurting people's feelings. we're going to be loud about the fact that we want quality health care. If I live on the far south side of Chicago, I don't want to have to drive 6 miles, 6, 7 miles, 8 miles, 10 miles to get to quality health care, because we know one thing: if you're having a stroke, you're having a heart attack, a high blood pressure issue, minutes matter. And I don't know any other politician that's been as boisterous as Lamont Robinson and kind of fired the rest of us up. I'm a healthcare advocate because I had cancer, but I don't know if I was loud enough on these issues, kind of saying, just the way it is, but it's not the way it is. And if we do nothing, it's going to stay that way. So, but again, healthcare industry, escalating costs. We know all the excuses that they give, trauma centers cost X number of dollars, blah, blah, blah. But we don't want to hear the excuses. We want the results.
Okay, so I want to stay there just one more second, Representative Evans, because I want to understand what you say when you say escalating costs. Are you saying that we are moving then towards a profit model of healthcare system where the cost and your ability to pay is really the bottom line in terms of whether or not medical centers stay open?
Yeah, the United States of America, I want to be crystal clear. We're not moving towards. We have a healthcare industry. We don't have a healthcare system in the United States of America. A system would move people and take care of people. Well, in the United States, we have a healthcare industry. If you can engage in the industry, then you got a better chance. If not, it's good luck to you. That's what we've been doing our lifetimes and beyond. I think folks like us, led by, and this issue definitely, Representative Robinson, we're saying, let's move towards a system. Let's have something where we can make people better, no matter how rich or poor you are. Let's make the United States and let Chicago be a lead for a healthcare system and not an industry.
Yeah, because I have to ask, Representative Buckner, we almost lost Mercy, and we're going to talk more about that in depth in a moment. But if that could happen to Mercy, I mean, could the same thing be true for Trinity, for South Shore, for St. Bernard? Like, are all of these hospitals on the South Side on the brink?
So Mercy absolutely was the canary in the coal mine. It showed us, what could and what people may attempt to happen again in our community. And thank God for the work of the folks on this call and our colleagues who around the city and the state were able to hold folks' feet to the fire and keep it open. But I want to make no mistake about it. What we saw at Mercy, we will see again in other places. And so we've got to look at the entire healthcare delivery system on the south and west sides of this city and figure out how do we not just survive, but how we put these places in the position to thrive. We fought tooth and nail, once again, led by Representative Robinson, to keep Mercy open. But what we do know is that when we won that fight, but what we do know is that at some point down the line, we're gonna get another fight from somebody else on something similar, right? And so we have to be ready. We have to be prepared. We have to be loaded for bear to make sure that we can properly address these issues. And I just want to say one more thing, Sylvia, if you allow me. I think both of my colleagues had tremendous answers on, kind of how we got here, what's wrong, and we'll talk more about what we need to do to move forward. But I want to make sure that we underline and underscore the fact that just like when we've had conversations about criminal justice, and the Black Caucus has said, we've got the criminal part right as far as the system is concerned, but the justice part doesn't exist. We've got the care part right in many places, but not the health part, right? And so if we're going to have a true healthcare system, true healthcare network, we've got to make sure that we're getting down to the bare bones of this and doing it the right way.
Okay, so let's just sort of dig a little bit deeper in terms of what we're talking about, because I think Mercy Hospital really kind of paints the picture of what exactly we're seeing across the city, and as Representative Robinson said, the state even. So Representative Robinson, Mercy Hospital is in the Douglas area of your district. When and how did you first learn that hospital was slated for closure?
Unfortunately, I learned the closure of Mercy Hospital in the news. And that is when I reached out to several colleagues that also had recent hospital closures. At the time, it was Representative Welch, Representative Kathleen Willis, Representative Bob Rita. All of these representatives had gone through this process. And I realized that something had to be done, that we could not lose this hospital that had been providing healthcare on the south side of Chicago for 100 plus years to the African American community.
So you found out on the news? They never even called you and told you?
Absolutely. And it also, if I may, in the midst of COVID. And so we know that hospitals did not have, there were staffing issues. And for a hospital, a $1 billion corporation called Trinity out of Livonia, Michigan, they also have a Loyola on the west on the west side of right outside of Chicago. So for a $1 billion corporation to close a hospital in the midst of COVID, I'm still grappling with that. I still don't understand, but that's where we are, and we were able to successfully keep the hospital open.
Yeah, and we're going to get to that part in a second. I just want to understand from you two, Representative Buckner and Evans, did you all find out about Mercy in the same fashion? You just turned on the news one day or opened your phone one day and saw it was closing? Is that how you found out?
That's correct. It is.
Yeah. No question. Yeah, I mean, we called around to each other like, what's going on? This is the reality.
Wow. Okay. So initially, what we all heard was that there was going to be a merger between 4 hospitals on the South Side to become a new system. And then the next thing we heard last July was that Mercy was closing because the state representatives refused to release $520 million to save the hospital. How much of that was true, Representative Evans?
Yeah, I think they're trying to figure out, because a lot of these hospitals are not large systems. Like Advocate is a large system. University of Chicago, these are large systems. So they're backed by, hundreds of billions and millions of dollars. But we have smaller systems. South Shore Hospital is an independent hospital, Jackson Park. So they did discuss coming together to figure out a plan. And that's their business. They have to figure out how to be profitable and provide quality health care. What we must demand is quality health care. So they threw out some ideas. I don't think those ideas came to fruition. I didn't support or oppose those ideas. The only thing I support is quality health care. I don't care who's providing it. Advocate, Trinity, South Shore Hospital. I want the best for our community. And I think that that idea, again, we can't miss the point that Representative Robinson's energy kind of helped to create the fact that hospital is still operating, and that the demand is out there, that we want quality health care, and let the rich folks figure out how to deliver that. They're getting Medicaid, they're getting Medicare, and they're getting private insurance. Don't abandon our communities.
Okay, so I just want to be clear then. There was some talk, at least, about forming a new system of hospitals to support 4 Southside hospitals, correct?
Yeah, there was a discussion, and there was some, but again, my understanding is that they decided not to move forward with that idea. And then again, that's entirely up to them. Now we can get into their business model, and I think it's, hospitals every day have different business models that they want to embark on.
So where then did the $520 million come from? Was that also accurate, or where did that come from?
Yeah, again, there was a lot of proposals thrown out. I know one thing that we did pass was transformation dollars. The federal government sent out money to allow hospitals to do innovative work, to reach out. I know some local hospitals received upwards to $170 million, and dollars were pushed around. But exactly what you're talking about with the plan, it's my understanding that they didn't move forward with that transformation plan, combining those hospitals. Had they moved forward, it could have potentially worked. But again, that was their business decision. I think my colleagues may have their own opinions on that, but they did not move forward with that. So all those hospitals are still independent, and we got to figure out a way with them to keep those hospitals going strong and to make them better.
Okay, and so then, Representative Buckner, then just for the record, it was never true then that you all refused to release money, and that's why the hospital was closing?
Listen, the truth of the matter is that no matter how many times people say that, it doesn't make it true because they keep saying it. The truth of the matter is that this group here, along with some of our colleagues who are in adjacent districts, wanted to make sure that whatever dollars came from the state level, whatever transformation efforts were put into place, did exactly what Leader Evans said, and that was provide the adequate and equitable amount of healthcare to the folks in our communities who need it. I'll speak for myself. It was beyond me to think that a service provider in a predominantly Black neighborhood would even threaten to pull the plug, right, to step away during a pandemic that we saw ravish the Black community, right? And so, no, we much like Leader Evans said, there was no staunch opposition or staunch support for these plans yet, but there were questions that we needed to be asked. And I'll say this, Sylvia, I think many of these questions had not been asked before. But what was important for us is to make sure that we called people to task and that we did the due diligence for the folks in our community who were elected to represent.
Okay, and so Representative Robinson, it sounds like closing Mercy Hospital was never even an option for you and your colleagues. It just was a non-starter. Why was that?
It's a non-starter because, again, we knew prior to COVID that the importance of having healthcare on the south side of Chicago. We already have food deserts and certain pockets of our districts that we serve, but we don't want to create a health desert. And the closure of Mercy Hospital would have created a health desert, and it would have exacerbated what we saw across the country as it relates to COVID. I also want to make a point. Chairman Buckner mentioned that there were several questions that we asked this group that wanted to close 3 hospitals. The main question that we were not able to ascertain was, where was the new hospital going to be built? Was it going to be built in Bronzeville? Was it going to be built in Beverly? How do we sign off? How do we approve the closure of 3 hospitals in our communities? And we could not ascertain clearly where the new hospital was going to be built. And so we were neutral on this proposal, but we had to be able to go back to our community and say very clearly where this new hospital was going to be built. And that was not answered from the group that brought us the bid or the proposal. We could not get clarity on where the new hospital was going to be built. And so for us, that was a non-starter. And we asked them to go back to the drawing board and come back to us with where the new hospital was going to be built. And then we learned after that Mercy Hospital was going to be shuttered. And so that is the truth. That I appreciate you giving us the opportunity to be able to make sure that the community understands the truth.
Yeah, no, of course, because, KNTV is the people's network. We try to bring the truth directly to the people, especially the people who oftentimes don't get their issues voiced in the news. So we thank you again for making the time and, being willing to be honest with the people about, kind of where things stood. So when that happened and you realized the situation that you were in, that, if you all didn't act, this hospital was in fact going to be shuttered, like, what did you do? Like, how did you go from we're closing indefinitely in the beginning of this year to no, we have a buyer, we have it saved? Talk a little bit about how you leapt into action on this.
Well, again, reaching out to my colleagues, Representative Rita, Representative at the time, Welch, Representative Willis, they had all went through this in their districts with hospitals that actually did close, that they unfortunately were not successful, and those hospitals unfortunately have closed. I think in Leader Welch's district, that hospital is reopening. But I reached out to my colleagues that had gone through the process, and then reached out to community groups in my district, and I assembled those folks, and for 8 months, we were outside protesting the closure of Mercy Hospital. And I have to thank the media for keeping that at the forefront. And I believe that is how we were able to be successful in keeping that hospital open. For 8 months, rain, sleet, snow, sunshine, I was out there. My colleagues were out picketing outside of Mercy Hospital to keep that hospital open. I could, say again, I'm appreciative of my colleagues, but truthfully, it was the community, it was the community groups, it was the clergy that really were out there supporting the efforts to keep the hospital open. That is how that hospital has remained open to this day. It's because of the community.
Okay, Representative Evans, I have to say, I think one of the things that we have learned from COVID, and one of the things that we certainly learned from the State of Black Health in Chicago report, is that Black folks are vulnerable. And there are not a lot of people fighting for Black interests. You talk about sort of, big, powerful healthcare giants kind of able to come in and buy and close hospitals whenever they see fit. And it feels like, it seems like a lot of people in our community don't have anyone at the table fighting for them to really see to it that these hospitals stay open. So we were able to, it seems, save Mercy. How do we keep this from happening again? And the next hospital doesn't close and leave our community a desert. How do we keep this scenario off the table?
Yeah, I think the first step is leaders like us and others at the top have to do their jobs. So Lamont Robinson, again, in this situation, stoked the fire amongst all the leaders, to say that we're going to fight for this. So then all of the leaders combined, they were aldermen, commissioners, everybody pushed for this. And we have to continue that momentum and push it down even to our everyday people, whether it's yourself, my mother, cousins. We have to demand a quality healthcare system in the United States. This is not just a Chicago fight. Go across the country. Where are Black people at? We are in Memphis, we're in Houston, we're in Miami-Dade, we're in the DMV. Wherever Black people are at, we don't have the healthcare which we deserve. We can't go back in time. We know that racism is a reality, but we're gonna fight in this moment for what we deserve, which is quality healthcare. And all the leaders are on the same page. We're fighting hard. We're watching the policies that we support. Now we have to keep the groundswell going. That it's not just about saving hospitals, but the next step is quality. I don't just want a car. I don't just want some chicken. I want some quality chicken. I want a quality car. I want a quality service. And our people deserve the best. So, and I think that, these are the things we can tell our people that have high expectations. When you go in the hospital, you should have services. And if you don't, we're going to make some noise. So we're going to make the noise, but we want to hear from the people. We demand quality.
Okay, and Representative Evans, I have to ask you this too, because I know that you've been in Springfield a while now. Even if you had given this hospital system $520 million, is there any guarantee that they would have then stayed open and actually built this new hospital system?
No. You know what they say, you can't give Black folks a book, because we start reading and analyzing. And we got an attorney on here, and Chairman Cam Buckner, and we got a business owner, and Lamont Robinson. And we start talking money and business to people that understand, we're going to ask you questions. And I don't think the deal was the best, but that's okay. There are going to be other deals. This healthcare system, and this healthcare industry is going to continue to develop. And until we make it a system, I think our people won't get what they deserve. So we're going to keep pushing. But of course, I don't think 500 million would have been enough. But again, that was their claim, and every other claims. But it doesn't matter about the deal from those folks. It's what we demand. The people will get what they demand.
Okay, so, Representative Buckner, you said something really interesting at the top that I just really want to hone in on as we get ready to wind down here. You said that we have the health thing that we need to work on. Care is good, but the health thing is something we need to work on. This report says we're not getting old. We're not living to our old age. We are not dying of natural causes, living long, full lives the way the rest of Chicago is. What do we need to do, or what should we expect from the state in terms of improving our health care outcomes in the long term?
So I'll start off by saying, I think from the folks on this call, the members of our caucus as well, you can expect that we continue to try to hold people once again accountable and create a system that works for all of us. And I think I speak for my colleagues, that's our charge. And if we come up short on that, then that's a conversation we have to have with the people who vote us in. You mentioned earlier about the realities that have come to the fore based on COVID. And I said a long time ago that COVID-19 was not going to break us, that we were too strong to be broken by this virus, but that COVID-19 would reveal to us the things that were already broken about us, right? It would shine a light on those systems and those processes and those procedures and those inequities that exist throughout our entire system. And we saw that, darkly, very clearly with our healthcare delivery system, our comorbidities in our community, healthcare disparities and what that looks like in a practical from practical standpoint. But I think that the next part, moving on from that, now that the light has been shined on top of these issues, light can do two things. It can either illuminate your way to move you forward, or it can blind you and render you, incapacitated and unable to move. So we've got to take this light that we're seeing and use it as a tool to take us to the next spot and the next step and to higher ground. And so I would implore all of your viewers to continue to be a part of this conversation, to hold us accountable, our colleagues on the city and the county and the federal level as well. We can only do this, as Leader Evans said, if we do it in conjunction with each other, lockstep, hand in hand, because the problem obviously is bigger than any of us. And so therefore the solution can be a single tiered or a single solution.
Okay, and Representative Robinson, since you've known me the longest, I will let you have the last word on this. What do you need from us to help move this forward? What do you need us to do?
And I think that Chairman Buckner hit it right on the head. But let me just reiterate, we need our folks to continue to stand with us. Look, the only reason that Mercy Hospital is open today is because of the community. Now, it also is a great example of when Black electeds stick together. We had folks at the federal level out protesting. We had folks at the city level, both alderwomen were there. We had Cook County commissioners. We had folks at the state, on the Senate, as well as the House side. When Black electeds come together, which we do, we can move the needle, and change is coming. And so I will ask your viewers to continue to pray for us, continue to understand that we are here for you, and we're working diligently to make sure that we move the needle for Black folks across the entire state, but also keep us at the forefront. Make sure that you hold us accountable, as Representative Buckner stated. Those are the things that you could do, and keep your eyes and ears open, and reach out to us when issues arise, or if you are not getting the proper quality health care, as Leader Evans mentioned. Reach out to us. Let us know if you're at Loretto, if you're at Jackson Park, and you're at South Shore, and something is not right for your personally or your family member. If you are not providing the service that you think that you deserve, then reach out to us. Let us know. We need to know this information. And so that is how the community can be helpful to us and help us to be able to do the jobs that we have.
Okay. Well, with that, I have to thank all three of you for being here today. And I do appreciate you making the time. Thank you all very much.
Thank you.
Thank you.
And to everybody at home, we appreciate you too so much. This Black Health in Chicago series is designed to give you the tools and the information you will need to empower yourselves to take control of your health and to help make Chicago a better, safer place for all of us to be. So please do continue to stay with us. Watch this space. We have so much more to come on this extremely important topic. Thank you and have a fantastic rest of the day.